Good evening, class. My name is Natalie Franco, and today I am recording my Unit 1 discussion. We have a case study here with Miss J, who's a 42-year-old Caucasian female who presented to the ED with complaints of a throbbing headache that started yesterday and increasing in severity after running out of her amlodipine. So, first question, who is the patient, including demographics, epidemiology, and risk factors? We do have a 42-year-old Caucasian female with hypertension as a major risk factor. For question number 2, what is the clinical syndrome signs and symptoms? So we have Miss J that is complaining of a throbbing headache that started yesterday and is increasing in severity after running out of her amlodipine, which is obviously to treat her hypertension. For question number 3, what is the difference between signs and symptoms? So many people use the word signs and symptoms interchangeably. However, there is an important difference that affect their use in the medical field. A sign is an objective evidence of a disease, such as a skin rash or a cough, while a symptom is a subjective, meaning that other people only know about them if informed by the individual with the condition. An example of a symptom is a stomach ache, lower back pain, fatigue, or even the headache in Miss J's case. For question number 4, what is the course or pattern of the signs and symptoms? So in the case of Miss J, the information given is too limited to acknowledge a pattern of the signs and symptoms. The only information given is that a headache started yesterday and is increasing in severity after she ran out of her amlodipine. According to the CDC, pattern refers to the occurrence of health-related events by time, place, and person. There are time patterns that may be annual, seasonal, weekly, daily, hourly, weekday versus weekend, or any other breakdown of time that may influence disease or injury occurrence. There's also place patterns, which include geographic variations, urban-rural differences, and location of work sites and schools. And personal characteristics, which include demographic factors, which may be related to risk of illness, injury, or disability, such as age, sex, marital status, socioeconomic status, as well as behaviors and environmental exposures. For question number 5, what additional information would you want to know from this patient? So I would definitely want to know the exact location of the pain, the severity. Um, is it dull? Is it sharp? Is it throbbing headache? I want to know all the characteristics of this pain. I would also like to know her height, weight, and other medical conditions, eating habits, other medications that she takes, other medical conditions. How long has she been without taking her amlodipine? Family history of headaches or migraines. And when was her last eye exam? And when was the last time she saw her cardiologist? All these questions are going to help the provider better diagnose and treat the condition. Lastly, we have question number 6. How would you facilitate communication to promote a participatory approach with this patient? From experience, it is important to always speak to your patient in layman's terms. Patients don't understand our medical language. That to them is scary. They think that they're dying and that they have, this horrible disease. So it's important to speak to them in a way that they understand, sit at their level, and answer any concerns that they have realistically. Don't lie to them and give them this unrealistic goals. This will definitely open up any patient to voluntarily give any information needed. Uh, Thank you for listening to me, and this is my Unit 1 discussion. Have a good day and good luck.